Well, we continue to follow the latest coronavirus developments in our state. Now we look to emergency room visits in the age of COVID and how COVID may be impacting trips to the ER. Joining us today is Dr. Anuj Vohra from Charlotte Hungerford Hospital. Thank you so much for taking time to talk with us.
No, it's my pleasure. Thanks for having me today.
Well, we might think that a decrease in people coming into the emergency room is a good thing, but that's not really the case. Why is that?
Well, as you know, we were seeing so many numbers throughout the country and they're on the rise. So we would expect that more people would come in for help, for care. And instead, we're seeing people fearful of using emergency departments and staying home and getting sicker. And what we really want is the people to come in early so that we can treat you and discharge you safer and healthier than you were beforehand. And what we are seeing is by the time people are coming in, they require oxygen support and admission. And these are very preventable things if you come in early. So we just want to urge patients to come in if they're not feeling well to get checked up, and we can make sure that they're okay.
For someone who might be hesitant of coming in because of coronavirus, what is your recommendation for them who are watching at home?
Well, I would say the most concerning symptoms would be shortness of breath and abdominal pain. You know, the flu-like symptoms of runny nose, congestion, a minor cough, that might be okay to stay home with. But if you're feeling more significant symptoms, I would definitely urge you to come in and get evaluated, because we just want to make sure that you're safe. And we've seen a lot of patients that have come in with minor shortness of breath that have had oxygen saturations in the 80s, 88, 89%, whereas healthy people like you or I should be at 97 to 100%. So if you're not feeling well, come in and get a quick checkup. There's never been a safer time to come into the emergency department. And, we're sanitizing every room after every patient, and we try our best to keep patients in all private rooms.
And from your perspective, doctor, why are COVID numbers continuing to rise at an all-time high?
You know, we expected this partially because of the holidays. And as much as people try to social distance, they're just not following all the recommendations. We had Christmas and now we have New Year's today. By the way, Happy New Year to you and all your viewers. But what we need to do is just give it a few more weeks of really staying vigilant on our social distancing. And we expect that numbers are going to continue to rise because we're just seeing the holiday finish and a New Year's holiday finish, and people are still doing some social gatherings. So we just need to hold on a little bit longer, continue to social distance and sanitize, because unfortunately we're going to see higher peaks than we've seen in the past in January.
Okay, definitely continue to follow those protocols. Keep everyone safe. Dr. Anuj Vohra, thank you again, and Happy New Year to you.
Thank you. Take care.